I'm Dr. Sammy Winemaker. I am a palliative care physician, and I'm here to help you right at the beginning of an illness journey, right after you get a diagnosis. You might be wondering, what am I supposed to do when I get a diagnosis? Most people don't know what to do. You've suddenly become a patient, maybe for the first time in your life. But there are things that you should know that will set you off on the right foot instead of being in the dark the whole time. So these questions that I'm about to share with you are going to help you to be in the know. It means you will have a really good idea about what information you should start trying to extract from your healthcare professionals so that you are always one step ahead. Okay, well, let's go ahead with the first question. The first question is, where are we now in the big picture of this illness? Okay, let me explain. Every illness has a roadmap. That means a pattern. It has a typical way of moving and unfolding over time. So every big illness has a beginning, a middle, a late, and possibly an end stage. And so billions of people have had these diagnoses before. So let's take one, for example, COPD, that's a lung disease. So billions of people have had COPD, and even though I don't know exactly what your COPD is going to look like, I know what COPD generally looks like. And so COPD has a typical beginning flavor to it. We know when someone's in the middle of it, and we know when someone's in the more advanced stage or end of that illness. So it's really helpful for someone with COPD or any other diagnosis to access that information. What does this overarching storyline of my illness look like? So that you have an idea of where you're at. You've been diagnosed. Have you been diagnosed in the beginning of the illness? Or have you received this diagnosis in the middle of the illness or more towards the end? That's very important because it puts the context out there for you so that you have an idea of where you're starting from. What's your starting line here? So we want you to be able to ask, again, question number one, where are we at in this illness? That's hugely important. You don't want to assume you're in the beginning when you're really deeper in, or you don't want to scare yourself and think you're deeper in when you're really at the beginning. So it's available to you. You just simply ask, what does this illness typically look like? Or you could say, what's the natural history of this illness? Or you could say, help me understand the big picture of this illness. You're asking for the same thing. You're asking for the footprint of this particular illness. Okay, so what's the second question that you might want to ask after you've been newly diagnosed with something? What can we do to be as well as possible? I mean, it seems very straightforward, but you won't naturally get that information. Mostly people will talk about what we need to do next, and we need to send you for this test, and it's important that you take this medication, and you'll get dizzy with all this information, this medical information. But many people want to know, what is it that I can do to be as well as possible? So for example, if you have COPD, which we talked about for question number one, which is a lung disease, there are things that a person with COPD can do to give themselves the best chance possible for being as well as possible for as long as possible. I'm not saying that that's easy, but a person has the right to know that if they choose certain lifestyle habits, if they kick certain lifestyle habits, if they stick to their medications that are prescribed to them, if they learn as much as they possibly can about their illness and stay informed. I could go on forever, but there are things that a person, a patient, can do themselves without having to wait for the healthcare system to make you feel better and make you be the best that you can be. There are things that you can know with your particular illness that will help you stay as good as possible for as long as possible. And who doesn't want that? So the third question that I want you to feel comfortable asking is, what are common signs of this illness worsening? Okay, so you might wonder, why would I want to know that? But the truth is that your mind will go there anyway. You will start fantasizing and dramatizing, catastrophizing what this illness is going to look like as time goes on. And you might find, like I'm just saying because I would be the same, that if you have a new diagnosis, that you begin to scan your body and wonder if anything that you're feeling is related to this illness getting worse. So you might think, oh, my ear is tingling, is that a sign? Or my finger hurts, is that a sign? I'm just kidding, but you know what I'm saying. You really want to make sure that you do not have any fake news that seeps into this information gathering. So knowing what signs are out there that will help you understand if your illness is changing or worsening, it will help you stay 2 steps ahead, and therefore putting you in a situation where you have to be reactive. So knowing what are the signs that your illness is worsening will help you prepare for the next step and help you to not think the worst. Because often when people have information about what the next stage looks like, they may have to adjust to it, but then they say, okay, they land and they plan. And that is the best way to stay steady in an illness that might be changing over time. Okay, question number 4. This is a good one to ask your healthcare providers. What are important things to prepare for next? Okay, because this is all about being proactive. That there should be very few surprises when you have a new diagnosis. Like I said in question number 1, most illnesses are well mapped out. So there are also certain things that most people should know they should prepare for so that they can use their time the way they want to. Getting all of these things done in a timely manner and attending to certain things after you have a diagnosis will free you up to harness what you like to do with your time, instead of you finding yourself jumping from one puddle to the next and not knowing what you're supposed to be prepared for and then being surprised by it. Things will be more efficient and take less time if we work in a proactive way. So that's just a little teaser, because I have a whole set of things that we will talk about in another video about what to prepare for next. Question number 5, what organizations and resources can support us? Because you do not have to go through this alone. There are lots of associations out there that are waiting and available to offer their support. Support in the form of information or support groups, someone to talk to, equipment, rides. You know, people often have lots of appointments, financial resources. So there's all sorts of support available for you, and all you need to do really is to open up your computer and search your diagnosis. So for example, if you've had Parkinson's, you can search Parkinson's resources or Parkinson's organizations. I live in Canada, so I could say Canadian Parkinson's Association and see what comes up, or supports for people with Parkinson's in Canada or in your region. And you would be surprised how many things come up for you and things you would not know about and that maybe your doctor doesn't know about. So you have to be a little bit resourceful yourself so that you can access all of these things instead of feeling like you're on your own and you have no idea what's available to you. Okay, so there you have it. We have now discussed the 5 most important questions after you have a new diagnosis that are going to help you on your illness journey. This is information that you will not naturally get if you just sit back and let the healthcare system do their thing. You have to step forward with important questions like these so that you get off on the right foot. Okay? So the good news is that we have all of this information beautifully written out in documents on our website called The Waiting Room Revolution. So waitingroomrevolution.com. All you have to do is go to the caption to access that information and look under roadmaps. That's where you're going to find this information. And please subscribe to our YouTube channel. We are going to make tons of videos that are going to help you have the best illness journey possible and be the best that you can be, all things considered.